It is our desire to support these elements in the process of evaluating their products with a view to finding local solutions to the menace of COVID-19 and other ailments. This informed the need to constitute a standing expert committee to screen these claims, identify products that would be recommended for further evaluation by NAFDAC, and plan for the appropriate clinical trials. In terms of preference of this expert screening committee, there are as follows. A, to compile lists of claimants with herbal medicinal products for management of various ailments. B is to develop appropriate protocol for evaluation of these claims and for other elements that are of priority in nature. Diseases like HIV, AIDS, malaria, diabetes, hypertension, and sickle cell anemia. C is to screen all claimants with the use of developed protocols for screening and identify those that merit being forwarded to NAFDAC for further evaluation. The inauguration of the committee today is an important step in the history of the ministry as we strive to develop a Tikam healthcare system to complement the Western medicine. I must state that government will continue to give leadership in the sector, and we are willing to partner with all stakeholders to strengthen what is our own.
The biggest challenge here is coordination. We have not been able to coordinate ourselves. We've been talking about this thing now for over 22 years on the reason, on the why we have to coordinate ourselves. A lot of things are happening in this country, and I can tell you the huge amount of knowledge that is trapped in this country. If we're able to open them up, we won't be looking for any outside drug. I believe that the inauguration of today's committee will unveil these issues that we're afraid of or we have not been able to see before now. We don't have data. We don't really have data. We have data here and there, but there's no coordinated data. So now we'll be able to put data together and see what Nigeria has, what are we using for what, and how are we going to add value, to such things. The examples you gave, yes, you are correct, but most of them add value. But here we don't have a kind of synergy that will enable our local producers or our local herbal practitioners to add value. We need to educate them. We need to train. We need to put a lot of structures on ground so that we'll be able to chest out and say this is our bio resources. These are God-given resources, and we are using it to the, to our best use for this country and for the health and needs of especially those who are at the primary, primary level, which are some of the ones we say that they are not financially buoyant. They can't go outside the country to go and take health care, but they can receive standard care if we're able to coordinate ourselves. We can really do it well. There will be need for us to move faster. So I believe that every agency is so connected. If we really want to achieve what we are aiming at, we should move faster. We are a little bit slow in too many things. And I'm happy with what the Ministry of Health is doing. I think this will ginger us up. Funding is still a major issue. But I'm convinced, I'm very, very optimistic that some provisions have been, put on ground for such things for this current year.